So since its discovery in the 1947, Zika virus has only been associated with very mild human illness. Typically, people who were diagnosed during that time period had a flu-like illness with fever, often accompanied by headache and body aches, often joint pain, and then a rash and conjunctivitis or reddening of the eyes are also very common in many Zika infections. We now know that the majority of Zika infections actually have no symptoms at all. People don't even know that they're infected by the virus. But the real concern now with Zika is that during the past few years, some very severe neurologic outcomes have been documented. The first of these severe outcomes was discovered in French Polynesia 2 years ago. It's called Guillain-Barré syndrome, and basically it can be triggered by a number of different viral infections where the immune system attacks our peripheral nerves, and this can lead to weakening of the muscles and sometimes to complete paralysis, but usually people recover over a period of a few years from this disease. The most concerning severe outcome is called congenital microcephaly. This is a condition where we believe that when Zika virus infects pregnant women, especially during the first trimester of pregnancy, the virus can cross the placenta and infect the fetus and then affect the development of the brain. So microcephaly is a condition where the size of the skull itself is smaller than normal, and often the brain is severely underdeveloped, especially in the cortex, which provides the higher order mental functions. So many of these babies, if they do survive to birth, have severe mental deficiencies that will probably persist for life. We don't know yet what the long-term outcome will be for these babies, and we also don't know whether there are more subtle effects of Zika virus infection that won't show up perhaps for a few years when developmental or learning disabilities can be diagnosed. There's very little doubt that Zika virus is responsible, at least in part, for both of these severe outcomes. We still don't know whether there are perhaps other cofactors that may contribute to these severe diseases, but there's really no doubt that Zika virus is involved at this point.
UTMB Health, working together to work wonders.